Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the Public Health Weekly Update for the last week of February 2023. As I have done in the last few months, I'm going to always focus the last one of each month on an update on infectious diseases. And today I'm going to do something I haven't done too much before, which is actually talk about some good news, but unfortunately also some bad news. Now, the reason I want to do an update on infectious diseases is that 2022 was a remarkable year in terms of outbreaks of infectious diseases. You'll remember this unprecedented global outbreak of monkeypox, now called Mpox, this disease that had previously only existed in Western Africa, an outbreak of Ebola in Uganda, an unknown cause of hepatitis in the US, cholera outbreak in Haiti, significant measles outbreak in unvaccinated children in Ohio, a case of polio in an unvaccinated man in New York. Of course, there was the major concern about respiratory syncytial virus, RSV, this disease that typically gets very young kids and old folks. Of course, as every year, there was influenza, and against the backdrop of this unprecedented COVID-19 pandemic. So there was a lot going on last year, and I want to give you a quick update on how we're doing with those, how we, the world, not personally. And fortunately, there's some good news. Seasonal flu is very low. You recall towards the end of last year, there was this huge spike of flu cases much earlier than we'd seen in previous years. And there was a very real concern that it was going to continue growing. But fortunately, it has come down and is now actually below where it was in many previous years. We're seeing the same pattern with RSV, respiratory syncytial virus. Again, this huge spike. At one point, there was about 5 times the normal number of hospitalizations. But as you can see, it has also come down and is somewhere in what we would say the range we would normally expect. Ebola in Uganda has now been declared to have been under control. The measles outbreak in Ohio is over 85 cases, over 30 hospitalizations, but fortunately no deaths, all in unvaccinated kids. The Mpox, the monkeypox, is now largely under control. Really a remarkable outbreak of a disease that had heretofore been largely limited to some countries in West Africa. There was only one symptomatic case of polio in New York in an unvaccinated individual. And as COVID-19 has come down, as you can see, it's pretty much as close to the lowest point in terms of daily deaths as we have seen historically. So good news. Things are coming under control. But not to let you down, I do also want to share some bad news. And the bad news, first of all, is that COVID hasn't gone away. Despite the fact that we all sort of feel like we've returned to normal, you can look and see that for the past, almost a year now, we've been running at a pretty stable level of daily deaths. If someone were to look at this out of the blue, they might say, well, what's happening is it's becoming a chronic disease in our country. Now, no one can say that because this disease has done such unusual things before, but clearly it hasn't gone away. And we see the same pattern with hospitalizations. They go up and down a little bit more, but largely in this same realm. And what we've seen is over 1,140,000 deaths in our country. For 2 years, it was the third leading cause of death. It's still a top 10 cause of death. But here's what has me worried. There's still 400 deaths a day. So this has not gone away. And this is just in the United States, about 4,000 hospitalizations a day. So this virus isn't having the spikes that we saw before, but it's still spreading. And the longer it spreads, the more likely it is to mutate. I think right now, most folks are thinking that we'll end up having to get an annual booster that's specific to the variant that's circulating, but we don't know for sure. It hasn't gone away. And as long as it continues to spread, it can continue to mutate. The second bad news, of course, is that there will always be new outbreaks. You may have seen the news about a Marburg outbreak in Equatorial Guinea. There's cases of, go a little slower with these. There's listeria outbreak in the United States. There's measles, MERS, there's cholera. And of course, as we talked about a couple of weeks ago, there's also this highly pathogenic bird flu, which has made the jump, at least to some mammals. So there's always going to be new outbreaks. But the worst piece of bad news from my perspective is that I think we may be less prepared for the next pandemic than we were for COVID. Not the scientists, not the researchers, not the healthcare community, but the public. What's one of the things that's happened over the last couple of years is all of a sudden people have started questioning the information that they're getting from reliable sources. There's so many people out there talking about public health issues. Not all of them are qualified. And unfortunately, what started to happen is some people are associating their news outlet affiliation with their thoughts on public health. They're associating their political affiliations with their thoughts on public health. Neither of those actually make any sense. But with all of this different information circulating, it's really hard for people to know who to trust. And if we don't trust the experts, we'll be condemned to repeat the pandemic of the past, and the next one could be worse. Now, this is not to say that anyone knows anything for sure, right? But if you don't trust the people who know the most, we're all going to be in trouble. If you review all the pandemics in recorded history, the most serious ones in terms of total deaths, COVID is there somewhere between 6th and 10th or so, recognizing that the world's population is much greater. But the point here is there can be a pandemic that is 100 times worse than what we've seen. So instead of 28,000 deaths in Tennessee, we might see 2.8 million deaths, right? If we don't trust the experts, the next pandemic could be worse. Now, this is not to say that any of us know everything. We really don't. One of the take-home lessons from COVID and every other outbreak is that we all need to have a little medical humility. And the way I like to talk about that with the students is to go back to the 1300s with the outbreak of the so-called Black Plague. Right? It killed between a third and a half, maybe more, of all of the people in Europe. A massively destructive pandemic. And yet at the time, it's part of our public awareness now of how bad a pandemic can be. But at the time, they had no idea that cultural changes in commerce and even some climate change was causing the spread of the rat. And they didn't know that on the rat was the oriental rat flea. And they didn't know that in the flea was Yersinia pestis. They didn't know enough to really try to control the outbreak at the time. And to me, that raises two very important questions. The first is, what don't we know today? Right? None of us should pretend to know what we don't know. But here's the second question. Who will you trust to tell you? If you trust a media outlet, elected officials, talking heads on the internet, you're going to run the risk of having to repeat some of the same mistakes that we made in the past when we knew even less than we do today. So in terms of monthly update, there's good news. Much of what we saw last year is going away. And there's some bad news in the sense that COVID is still here. There are new outbreaks going on every day. But really, the bad news to me is we've lost our confidence in the authoritative voice of public health and health officials, and we've got to get it back. Please feel free to share this video or any of these with anyone who's interested. If you know anyone who'd like to be added to the mailing list, please let me know. Thanks, as always, to Dara Young for editing, producing, adding captions, and posting this video. And if you have any comments, questions, concerns about what I've talked about today or any other evolving public health issue, please let me know. I look forward to hearing from you. Until next week, please be well.